They're the most vulnerable,
We are still very much in the throes of COVID.
and they're still at risk.
This variant has dangers as well.
So why isn't Ohio doing more to keep nursing home residents safe?
I just couldn't believe that people wouldn't want to jump in line and get that vaccine.
Tonight, a failure to protect. Our News 5 investigation found Ohio nursing homes have one of the worst COVID vaccination rates in the country.
News 5 investigator Sarah Buttison joins us with more on her findings. Sarah?
You both may remember that nursing home staff and residents were first in line for the COVID-19 vaccine. But we found Ohio is almost dead last when it comes to the numbers of staff and residents who got the shot.
At the end of 2020, COVID struck Welcome Nursing Home in Oberlin.
This became incident command at the beginning of our COVID journey.
Owner Jill Heron tried to keep it at bay,
This is our testing area.
but it swept through the building.
So these were the PCR tests that we would send to the lab.
20 residents and a staff member died.
It was devastating.
So, when the COVID vaccine became available, she thought staff would sign up.
We really felt like the vaccine was the light at the end of the tunnel, like, oh my goodness, here we are again.
But that light remains out of reach.
I mean, if I could wave my magic wand and just say everybody's vaccinated, I would love that.
Nearly 1/3 of her staff are still unvaccinated.
But the reality is that that's not who we are as a community.
Or a state. We found Ohio is the 49th in the U.S. when it comes to vaccinating nursing home staff. Only Missouri's numbers are worse. We found 6 Northeast Ohio facilities where not even half the staff are vaccinated, including the Heights Rehabilitation and Healthcare Center in Broadview Heights, Eagle Point Skilled Nursing and Rehab Center in Orwell, and Longmeadow Care Center in Ravenna. Ohio's not doing much better vaccinating residents. It ranks 45th.
It's disappointing that we're not further than we are.
Dr. Brian McLean is a regional medical director for the state team that helps long-term care facilities manage COVID outbreaks.
We know that bad things can happen to you and have happened to people who have not been vaccinated.
Especially the elderly. Patients over 60 account for 87% of Ohio's COVID deaths. A quarter were nursing home residents.
There's not a credible reason to not get the vaccine in a healthcare environment.
Data shows the vaccine is safe, and COVID comes with other costs for the elderly. Dr. McLean has watched death rates increase for heart attacks and strokes, long haulers lose their quality of life, and social isolation spark depression.
It's impossible to argue that a fully vaccinated healthcare worker with appropriate personal protective gear on is the safest situation.
And how hard is it to find caregivers like that?
Yeah, I mean, that's the other thing. I mean, we're in the midst of a workforce crisis in healthcare.
A crisis made worse by COVID. But that's not why Jill hasn't let go of her unvaccinated staff. They're the same workers who were back here in December of 2020, caring each day for residents, despite a deadly outbreak.
I just didn't feel like I could say, you were good enough to put your life on the line when we didn't know what COVID was, but you're not good enough as a caregiver because you've chosen not to get the vaccine.
So how do staff get around the federal mandate requiring they get vaccinated? They can apply for religious and medical exemptions. If you're looking for a specific nursing home's vaccination rate, go to news5cleveland.com and click on our report. I'm News 5 investigator Sarah Buttison.